Hi, it's Dr. Yasmin Zadeh. I'm a pediatric dentist. So I want to talk about flossing and why flossing is so challenging for parents and for kids. First of all, it's the younger kids, it's hard for them to keep their mouth open. It's hard for the parents to get into their small mouth and try to floss in between the teeth. And also kids don't really understand the point of the flossing unless they're older, or it doesn't just feel good after doing a flossing, just like toothbrushing. Like, when you're brushing your teeth, it feels clean afterwards. So they're like, oh, okay, they understand it better. But when it comes to flossing, it doesn't really feel any different unless like there's a food stuck in between the teeth. So that's why they're like, they don't really understand it. And it's really hard for parents to get in there and floss. It's not as easy as brushing for sure. So we would like for parents to start flossing their child's teeth if the teeth are having contact. So as soon as the teeth are having contact, that's when we would like to have parents start flossing. Usually the front teeth, most kids they have a lot of space, so they don't need to floss until they're a little bit older. But the back teeth, when the molars come in and they start touching, I want to say age of 2 or 3, that's when they want to start flossing their teeth. The floss picks are as effective as the traditional floss, but it also depends on how it's done. We want to make sure that we're not just putting the picks in between the teeth and taking them out. We want to make sure we're putting the floss against the tooth, and and we're sliding it down and up to take off the plaques. Because sometimes parents they ask me, "Oh, we just like put it in and out," and I have them show it to me, and it's not really effective unless you are putting the floss against the tooth and taking it out and then putting it and against the other tooth and pulling it out. So I try to show it to the parents when they're in the office and they understand it better. So what happens is that when they skip flossing, the food stays in between the teeth and it can cause interproximal or in between cavities in teeth, or it can, over time causes periodontal diseases. And sometimes they say, oh, there's, my child has a bad breath. And then when you ask them, they're like, oh yeah, they don't floss their teeth. So it can cause also bad breath. It's a struggle for parents to make sure they're flossing their child's teeth every night. So we sometimes you have to be more, realistic. Like it's really hard to do it every night. And I totally understand as long as you are flossing your child maybe 3 to 4 times a week, it should be okay. And you want to pick a time that give yourself a little bit of time. The flossing should be done before brushing, and you don't want to wait till the child is like really tired, they don't want to brush, they don't want to floss. So just like give yourself a little more time and make sure your child is not too tired to get in there, floss their teeth. Or you can always, for the younger kids, I'm not a big fan of iPads, but you can always like play a movie, little like, song or something, have them watch and then you're flossing the teeth. Or you can have them lay down on their bed. The reason I say that is because it's so much easier for parents to access versus a child standing and moving around. Just like, when they're in a dental chair, they're laying down. So it's easier to access. And again, the timing is important and the way it's done. The way flossing prevents cavities in between the teeth is that when the food stays in between the teeth over time with the acid and the saliva, can cause definitely cavities in between the teeth, in proximal cavities. And also the plaque accumulation, all that can cause gum disease. So it's extremely important to floss. And now we also know that brushing and flossing is very connected with other systemic diseases. So if you're not brushing and flossing your teeth, you're increasing your chances of heart disease and other diseases. So it's not just about teeth, it's about the whole body. What we try to do to explain to parents who don't understand the importance of flossing is that flossing is as important as brushing teeth, and it starts with the parents. If they are flossing and brushing their teeth at home, the children look up to them and they also do the same thing. And as you know, we all know that kids, they listen, they do what we do more than what we tell them. So if we have good habits, they pick up those habits too. And we'll also explain to parents, if you're not flossing your child's teeth over time, plaque and the food accumulation between the teeth can cause interproximal cavities, or cavities that grow in between the teeth, and that small cavity that we could prevent it with flossing. Now it's a filling, or that filling can grow and turn into a root canal, or sometimes it can turn into an infection, and we have to remove the teeth over time, and it affects their child's speech or their eating. So that one small habit can really affect also the whole body. And we know that flossing and brushing can prevent a lot of health problems as well. So we just explain it to them and they understand.